A report by several non-governmental organizations in Kenya has raised doubt about the success of plans to devolve essential municipal services to counties. Joining us now live from Nairobi to discuss the need for clear distinction of roles in services provision is Elias Wakhisi, Program Leader for the Institute for Social Accountability. Elias, thanks very much for your time. It's interesting.
Thank you so much.
Yeah, I wanted to say at the outset that it's very interesting what's happening in Kenya and what's happening here in South Africa in terms of cities development. Because on Monday, I think we had an interview with one of the mayors of the local regional municipalities, and we're talking about the 2055 plan by the government, and it involves around creating larger cities. And what they are doing is actually to create larger cities that govern the areas where they are in, versus what's happening in Kenya, where you're actually devolving these powers and you're giving them to local municipalities and reducing those in size to counties. That's very interesting. And it's interesting to then think, what would work better in your view?
Yeah, it's very interesting. In fact, Kenyans on 4th March 2013, this year, they voted in overwhelmingly for a new system of government, and which is the devolve system of government. For us, it's a two-tier system where we have the national government up there and 47 counties. Again, with that particular election, on around end of March, the governors who will be in charge of these counties were sworn in together with their legislative organs, which are county assemblies. The county government has, the county has a county government, and at the same time, it has a county assembly. So it's very interesting. And of course, Kenyans voted in for this new constitution in 2010 on the basis of this new system of government, on the belief that with the devolution, you will have greater accountability, you will have access to service delivery, and of course citizens will then be engaged in the process, as opposed to the previous centralized system of government, where even simple immigration services, you had to come to the capital of Kenya, which is Nairobi, to get those services. So it's very interesting, and Kenyans are very optimistic about this new system of government, believing that it will really offer a lot of stuff.
But you are worried, and other people are worried, that what you may actually emerge is a situation where services, the quality of services delivered and the ability of those services to be delivered will actually be compromised. Talk to us about that.
Yes, we are very worried because of, with this system, there's, with devolution, there's a very critical element in devolution called function assignment. And in function assignment, then you have to agree on which services have to be devolved. You have to agree on when are they supposed to be devolved, to which organs, and who will handle specific services. For us as a country, with the Constitution established phase transfer of services, and establish an authority called the Transition Authority to facilitate that particular process. The TA, which is the Transition Authority, then provided a three-phase transfer period. The first period being pre-election, where they set in place structures, where they send to the ground interim transition teams to be able to prepare for this transition process. Then the actual transfer that happens immediately after these counties have been in place. And then the third phase comes with then capacity building of these counties to be able to take up these particular functions. Our worry as institutions, and coming from Tisa, we, with a number of institutions that have worked in the area of devolution, came together to just analyze the considerations, to analyze the resource requirements, and also to analyze the preparedness at both at the county level and the national level for this devolution process. What we found out is that this process has really, really delayed, in that a number of very key basic services may not be delivered because of this delay. And I'll start maybe by enumerating.
One, no, I was going to ask you actually, Elias, if I can hold you right there. I wanted to ask you, which ones do you think would work to devolve first, and when?
What the Transition Authority has done is to enumerate for us services that have to be involved immediately, to be devolved immediately in the first phase of this particular transition period. But again, there's education sector, there's housing sector, and health, and water. These are very critical sectors that if devolution, if the transfer, and if that function assignment is not done properly, then we might have a situation where there's disruption of service delivery, which may undermine that confidence of the public in the system, because they expect that with the service, with the devolution process, then services will become closer.
Yeah.
And I wanted to enumerate just a bit of it.
Yeah.
One is the health sector. When you look at the health sector, previously, in the previous system, we had these provincial hospitals. Up to now, these provincial hospitals are then shared functions among counties.
Yeah.
You'll have one provincial hospital that is shared by around 3 or to 4 counties. How will this facility be managed? Is it a county facility?
Yeah.
Is it a national facility? The other important aspect is immunization and tuberculosis control.
Right.
Of course, in economic terms, these are those public goods that you don't want to tamper with. The national government has already indicated that those are national services. But when you look at the budget documents, they've already devolved these services. So there's that confusion around those particular facilities. Let's go to education.
Sorry, Elias, we're actually running out of time, unfortunately, and this is a topic certainly that we should have allocated more time, and hopefully we can continue this conversation another time, because there's certainly more to be said. For instance, what would you think would be the services that ought to be perhaps devolved now and those that would not be devolved later? But we have to take that conversation another day. Elias Wakhisi, Program Leader of the Social Institute for Social Accountability, joining us live from Nairobi.